Certified Nursing Assistant Infection Control.
Question 1. Which action shows correct handling of a urinary drainage bag for a resident in bed? Option A. Hang the bag higher than the level of the resident's bladder. Option B. Use the measurements on the bag to measure urine output. Option C. Raise the bed to the highest position for drainage. Option D. Wear gloves when emptying the urinary drainage bag.
The correct answer is option D. Wear gloves when emptying the urinary drainage bag. Standard precautions require gloves when handling body fluids to prevent the spread of infection.
Question 2. True or false? Hand washing should be performed for at least 20 seconds. Option A. True. Option B. False.
The correct answer is option A. True. 20 seconds of scrubbing is necessary to mechanically remove pathogens from the surface of the skin.
Question 3. True or false? Standard precautions should be used for all residents regardless of their diagnosis. Option A. True. Option B. False.
The correct answer is option A. True. Standard precautions assume all body fluids are potentially infectious and protect both staff and residents.
Question 4. True or false? You must always wear a mask when entering a room under droplet precautions. Option A. True. Option B. False.
The correct answer is option A. True. Masks prevent the inhalation of large respiratory droplets that carry infectious pathogens.
Question 5. True or false? It is necessary to wear gloves when providing a back massage. Option A. True. Option B. False.
The correct answer is option B. False. Gloves are not required for a back massage unless the resident has broken skin or a contagious condition.
Question 6. Standard precautions are used for which group of residents? Option A. Only residents with known infections. Option B. Only residents in the intensive care unit. Option C. All residents whenever providing care. Option D. Only residents who are coughing.
The correct answer is option C. All residents whenever providing care. Standard precautions assume that all blood and body fluids are potentially infectious.
Question 7. What is the correct order to put on personal protective equipment? Option A. Gloves, gown, mask, goggles. Option B. Gown, mask, goggles, gloves. Option C. Mask, goggles, gown, gloves. Option D. Gloves, goggles, mask, gown.
The correct answer is option B. Gown, mask, goggles, gloves. Putting the gown on first and gloves on last ensures maximum coverage and protection.
Question 8. What is the correct order to remove personal protective equipment? Option A. Gloves, goggles, mask, gown. Option B. Gown, mask, goggles, gloves. Option C. Mask, goggles, gown, gloves. Option D. Goggles, gloves, gown, mask.
The correct answer is option A. Gloves, goggles, mask, gown. Removing gloves first prevents the contamination of the rest of the removal process.
Question 9. What is a pathogen? Option A. A microbe that is helpful to the body. Option B. A microbe that is harmful and can cause infection. Option C. A type of cleaning chemical. Option D. A professional healthcare worker.
The correct answer is option B. A microbe that is harmful and can cause infection. Pathogens are responsible for causing diseases.
Question 10. What does the term sterile mean? Option A. The presence of some bacteria. Option B. The absence of all microbes. Option C. Being very clean. Option D. Free of visible dirt.
The correct answer is option B. The absence of all microbes. Sterility is required for procedures like surgery or catheter insertion.
Question 11. What specific factor of hand washing is most responsible for removing germs? Option A. The temperature of the water. Option B. Friction. Option C. The scent of the soap. Option D. The brand of paper towel.
The correct answer is option B. Friction. The mechanical action of rubbing the skin removes pathogens.
Question 12. Which two bloodborne pathogens are of the most concern in healthcare? Option A. Influenza and the common cold. Option B. Human immunodeficiency virus and hepatitis B. Option C. Staphylococcus and streptococcus. Option D. Measles and mumps.
The correct answer is option B. Human immunodeficiency virus and hepatitis B. Standard precautions are designed to protect against these serious bloodborne diseases.
Question 13. What kind of gloves should you use when cleaning up a chemical spill? Option A. Standard latex gloves. Option B. Rubber utility gloves. Option C. No gloves are needed for cleaning. Option D. Plastic food service gloves.
The correct answer is option B. Rubber utility gloves. Utility gloves provide better protection against harsh cleaning chemicals.
Question 14. What is the definition of a non-pathogen? Option A. A microbe that causes a severe infection. Option B. A microbe that does not cause infection and is often beneficial. Option C. A type of cleaning chemical. Option D. A person who is not sick.
The correct answer is option B, a microbe that does not cause infection and is often beneficial. Many non-pathogens live on the skin and in the digestive tract to help the body.
Question 15. What is medical asepsis also known as? Option A. Sterile technique. Option B. Clean technique. Option C. Contamination. Option D. Disinfection.
The correct answer is option B, clean technique. Medical asepsis involves removing or destroying pathogens to prevent their spread.
Question 16. Which precaution should be used for a resident with the flu? Option A. Airborne precautions. Option B. Droplet precautions. Option C. Standard precautions only. Option D. Contact precautions only.
The correct answer is option B, droplet precautions. Droplet precautions protect against pathogens spread through coughing and sneezing.
Question 17. Which precaution is specifically used for a resident with tuberculosis? Option A. Contact precautions. Option B. Airborne precautions. Option C. Droplet precautions. Option D. No precautions are needed.
The correct answer is option B, airborne precautions. Airborne precautions require a special respirator mask and a negative pressure room.
Question 18. What is scabies? Option A. A common skin rash. Option B. A skin disorder caused by a female mite that burrows under the skin. Option C. A bacterial infection of the lungs. Option D. A type of allergic reaction to soap.
The correct answer is option B, a skin disorder caused by a female mite that burrows under the skin. Scabies is highly contagious and requires specific medical treatment and isolation.
Question 19. Which action is correct for handling a catheter drainage bag while the resident is in bed? Option A. Hang it higher than the bladder. Option B. Use the bag markings for measurement. Option C. Raise the bed as high as it goes. Option D. Wear gloves when emptying the bag.
The correct answer is option D, wear gloves when emptying the bag. Standard precautions require gloves when handling any body fluid to prevent infection.
Question 20. Which of these is an example of disinfection? Option A. Washing hands after toileting. Option B. Wiping around a stoma. Option C. Cleaning a shower chair with a chemical cleanser. Option D. Washing a bath basin with soap.
The correct answer is option C, cleaning a shower chair with a chemical cleanser. Disinfection uses specific chemicals to kill pathogens on shared equipment.
Question 21. To minimize the spread of bacteria and contamination, which procedure should be used for washing the perineum of a resident with a catheter? Option A. Wash from the rectum to the meatus. Option B. Wash from the rectum to the scrotum. Option C. Wash from the meatus out. Option D. Wash with peroxide.
The correct answer is option C, wash from the meatus out. Washing from the meatus outward prevents pulling bacteria from the anal area into the urinary tract.
Question 22. Which of these should not be part of the process for cleaning a resident's dentures? Option A. Patting the sink with a towel. Option B. Placing clean dentures on top of a tissue on the resident's table. Option C. Rinsing the dentures thoroughly. Option D. Washing your hands before and after.
The correct answer is option B, placing clean dentures on top of a tissue on the resident's table. Dentures should be stored in a labeled denture cup with water to prevent drying out or contamination.
Question 23. According to recommendations from the Centers for Disease Control and Prevention, the scrubbing portion of hand washing should take how long? Option A. Any amount of time as long as you scrub until hands feel clean. Option B. 20 seconds. Option C. 60 seconds. Option D. 10 seconds.
The correct answer is option B, 20 seconds. Scrubbing for 20 seconds is the standard requirement to effectively remove pathogens.
Question 24. A nursing assistant caring for a resident with an antibiotic-resistant infection is wearing a gown and gloves. Where should she dispose of them? Option A. In the current patient's room. Option B. Continue wearing equipment to the next room. Option C. In the hallway trash can. Option D. In the next patient's room before touching that patient.
The correct answer is option A, in the current patient's room. Personal protective equipment must be removed before leaving the contaminated environment.
Question 25. Which of these is incorrect in reference to wearing gloves? Option A. Peel the glove away so it comes off inside out. Option B. Wash your hands before and after removing gloves. Option C. Always wear latex gloves because they are the most impermeable option. Option D. Avoid letting the outer layer contact your skin during removal.
The correct answer is option C. Always wear latex gloves because they are the most impermeable option. Vinyl or nitrile gloves are often used because of the high prevalence of latex allergies.
Question 26. All of these could be described as positive benefits of religion except which of the following? Option A, serving as a way for the resident to separate from his or her family. Option B, helping to facilitate a sense of meaning and comfort. Option C, improving health outcomes through a positive attitude. Option D, as a means for increasing tolerance to cope with difficulties.
The correct answer is option A, serving as a way for the resident to separate from his or her family. Religion typically provides support and community rather than causing isolation from family.
Question 27. When performing care activities, when should gloves be worn? Option A, when you are feeding a resident. Option B, when you are helping with ambulation. Option C, when performing perineal care. Option D, when you are changing a resident's clothing.
The correct answer is option C, when performing perineal care. Gloves are required whenever there is a potential for contact with body fluids.
Question 28. Which of these is not a way to help a resident who is dealing with impending death? Option A, sitting and listening if they want to talk about it. Option B, spending more time with the resident than you normally would. Option C, spending less time with the resident so there is no pressure. Option D, giving the resident privacy if they ask for it.
The correct answer is option C, spending less time with the resident so there is no pressure. Isolation can be frightening for a dying person. Your presence provides comfort.
Question 29. When giving evening care to a client with dentures, where should they be placed? Option A, in the bathroom on the sink. Option B, in a tissue on the bedside stand. Option C, under the client's pillow. Option D, in a denture cup with the client's name.
The correct answer is option D, in a denture cup with the client's name. Proper storage in a labeled cup prevents loss, breakage, or contamination.
Question 30. Which type of precautions are used for every resident regardless of their diagnosis? Option A, contact precautions. Option B, standard precautions. Option C, droplet precautions. Option D, airborne precautions.
The correct answer is option B, standard precautions. Standard precautions prevent the spread of pathogens through blood and body fluids.
Question 31. What equipment is required for airborne precautions? Option A, surgical mask and gloves. Option B, gown and gloves and an N95 respirator mask. Option C, goggles and gown only. Option D, face shield only.
The correct answer is option B, gown and gloves and an N95 respirator mask. Airborne pathogens are very small and require specialized respirator masks for protection.
Question 32. In which direction should you rinse your hands during the hand washing process? Option A, fingertips pointing up. Option B, fingertips pointing down. Option C, hands held flat. Option D, it does not matter.
The correct answer is option B, fingertips pointing down. Rinsing with fingertips down allows pathogens to flow off the hands and into the sink.
Question 33. What is a pathogen? Option A, a helpful microbe. Option B, a harmful microbe that causes infection. Option C, a type of cleaning chemical. Option D, a professional healthcare worker.
The correct answer is option B, a harmful microbe that causes infection. Pathogens include bacteria and viruses that make people sick.
Question 34. What does sterile mean? Option A, very clean. Option B, the absence of all microbes. Option C, free of visible dirt. Option D, using a lot of soap.
The correct answer is option B, the absence of all microbes. Sterility is required for invasive procedures like surgery.
Question 35. What is asepsis? Option A, a serious infection in the blood. Option B, being free of disease-producing microbes. Option C, the growth of bacteria. Option D, a medical diagnosis.
The correct answer is option B, being free of disease-producing microbes. Aseptic techniques are used to keep the environment safe for residents.
Question 36. Which factor of hand washing is most responsible for removing germs? Option A, the temperature of the water. Option B, friction from rubbing hands together. Option C, the brand of soap. Option D, the type of paper towel.
The correct answer is option B, friction from rubbing hands together. Friction physically removes pathogens from the surface of the skin.
Question 37. What is the definition of contamination in an infection control context? Option A, the process of cleaning a room. Option B, the process of becoming unclean. Option C, the act of washing your hands. Option D, the process of healing a wound.
The correct answer is option B, The process of becoming unclean. Contamination occurs when pathogens are introduced to a clean or sterile surface or area.
Question 38. Which precautions should be used when providing standard care to all residents? Option A, contact precautions. Option B, droplet precautions. Option C, airborne precautions. Option D, standard precautions.
The correct answer is option D, standard precautions. Standard precautions are the baseline for all care and assume all body fluids are potentially infectious.
Question 39. What personal protective equipment is required for contact precautions? Option A, a mask and goggles. Option B, a gown and gloves. Option C, a respirator mask only. Option D, a face shield and cap.
The correct answer is option B, a gown and gloves. Contact precautions protect against pathogens spread by direct touch or contact with contaminated surfaces.
Question 40. Which type of isolation precaution requires the use of a specialized respirator mask? Option A, contact precautions. Option B, droplet precautions. Option C, airborne precautions. Option D, standard precautions.
The correct answer is option C, airborne precautions. Airborne pathogens are tiny and remain suspended in the air, requiring filtered respirators like the N95.
Question 41. What is the correct order for putting on personal protective equipment? Option A, gloves, mask, goggles, gown. Option B, gown, mask, goggles, gloves. Option C, mask, goggles, gown, gloves. Option D, goggles, gloves, gown, mask.
The correct answer is option B, gown, mask, goggles, gloves. The gown is applied first to cover the uniform, and gloves are applied last to overlap the gown cuffs.
Question 42. What is the correct order for removing personal protective equipment? Option A, gloves, goggles, mask, gown. Option B, gown, mask, goggles, gloves. Option C, mask, goggles, gown, gloves. Option D, goggles, gloves, gown, mask.
The correct answer is option A, gloves, goggles, mask, gown. Removing the most contaminated item, the gloves, first prevents the spread of pathogens during the removal process.
Question 43. What is a pathogen? Option A, a helpful microbe that lives in the gut. Option B, a harmful microbe that can cause infection and disease. Option C, a type of medical equipment. Option D, a healthcare worker.
The correct answer is option B, a harmful microbe that can cause infection and disease. Pathogens include bacteria, viruses, and fungi that cause illness.
Question 44. What is the definition of asepsis? Option A, a severe infection in the bloodstream. Option B, being free of disease-producing microbes. Option C, the growth of bacteria. Option D, a type of physical therapy.
The correct answer is option B, being free of disease-producing microbes. Aseptic techniques are used to keep residents safe from infectious germs.
Question 45. Which factor of handwashing is most important for removing pathogens? Option A, the temperature of the water. Option B, friction. Option C, the scent of the soap. Option D, the type of paper towel.
The correct answer is option B, friction. The mechanical action of rubbing the hands together physically removes germs.
Question 46. True or false, standard precautions are used for all residents? Option A, true. Option B, false.
The correct answer is option A, true. Standard precautions protect staff and residents from all potential pathogens.
Question 47. True or false, you must always wear a mask for droplet precautions? Option A, true. Option B, false.
The correct answer is option A, true. Masks prevent the inhalation of large respiratory droplets that carry germs.
Question 48. True or false, you must always wear gloves for a pericare? Option A, true. Option B, false.
The correct answer is option A, true. Gloves protect the assistant from contact with urine and feces.
Question 49. When washing hands, you should wash with your fingers pointing in which direction? Option A, pointing upward. Option B, pointing toward your body. Option C, pointing downward. Option D, it does not matter.
The correct answer is option C, pointing downward. Pointing fingers downward allows water and soap to flow away from the clean areas and into the sink.
Question 50. With catheterized patients, which of the following is not the nursing assistant's responsibility? Option A, inserting the catheter. Option B, preventing infection. Option C, checking to make sure it is draining properly. Option D, recording output.
The correct answer is option A, inserting the catheter. Catheter insertion is a sterile procedure that must be performed by a licensed nurse.
Question 51. When getting ready to make a bed, the nursing assistant should place the clean linens where? Option A, on the floor next to the bed. Option B, on the resident's overbed table. Option C, on a chair or table beside the bed. Option D, on top of the dirty linens.
The correct answer is option C, on a chair or table beside the bed. Clean linen should only be placed on clean surfaces to prevent contamination.
Question 52. Articles contaminated with blood or body fluids should be disposed of in which container? Option A, the regular trash can. Option B, the laundry hamper. Option C, the biohazard container. Option D, the recycling bin.
The correct answer is option C, the biohazard container. Specialized containers are required for medical waste to prevent the spread of pathogens.
Question 53. Which method is the correct way to remove a dirty isolation gown? Option A, pull it off over your head. Option B, roll the gown dirty side in and away from the body. Option C, shake the gown to get the germs off. Option D, drop it on the floor for housekeeping.
The correct answer is option B, roll the gown dirty side in and away from the body. Rolling the gown inward traps pathogens inside and prevents them from touching your uniform.
Question 54. A nursing assistant must wear gloves when performing which task? Option A, helping a resident walk. Option B, providing mouth care. Option C, brushing a resident's hair. Option D, feeding a resident a sandwich.
The correct answer is option B, providing mouth care. Mouth care involves contact with mucous membranes and saliva, which requires standard precautions.
Question 55. If you need to wear a gown for a client in isolation, when must you take it off? Option A, at the nurse's station. Option B, before leaving the client's room. Option C, in the cafeteria. Option D, when you get home.
The correct answer is option B, before leaving the client's room. Taking the gown off in the room prevents the spread of pathogens to the rest of the facility.
Question 56. Which of the following is the best way to prevent the spreading of germs? Option A, wearing gloves during patient care. Option B, wearing a mask and gloves during patient care. Option C, hand washing before and after patient care. Option D, wearing a gown, mask and gloves while performing patient care.
The correct answer is option C, hand washing before and after patient care. Hand washing is the single most effective method for preventing the transmission of pathogens and cross-contamination in healthcare settings.
Question 57. Contact precautions include which of the following? Option A, mask, gown and gloves. Option B, gloves and gown. Option C, mask, gown, gloves and face shield. Option D, mask, gown, gloves and shoe covers.
The correct answer is option B, gloves and gown. Standard contact precautions require the use of a gown and gloves to prevent spread via touch.
Question 58. The CNA is assigned to care for a client with measles, which requires airborne precautions. All of the following PPE is required except Option A, booties. Option B, gloves. Option C, gown. Option D, N95 mask.
The correct answer is option A, booties. Booties. PPE for airborne includes gloves, gown, and N95. The client's door should also remain closed with a notice on the door. Booties are not required.